Hi, I'm Deborah.
And I'm Lawrence.
And in this video, we're going to talk about the reaction that a lot of people with depression get when
they talk about their depression.
Yeah, when they tell someone, I've been diagnosed with depression, or I think I have depression. Sometimes you'll get a supportive response, like, oh, I'm sorry to hear that, or do you need help with anything, or do you want to talk about it?
That's the hope, but chances are
there are a lot of people who still get the same responses, like, oh, that probably isn't it. Now,
oh, that can't be it.
That can't be it.
You don't seem depressed.
Yeah, right. Let's say you said to them, I've been diagnosed with diabetes. Their likely response would be, oh, I'm sorry to hear that, or that sucks, or something like that.
They're not going to say, oh, that can't be it. You don't seem fat.
Right. Although I'm sure there are some people who don't realize that you don't have to be overweight to have diabetes.
Yeah, I forgot about that part. Apologies to any people who are diabetic and not genetic. Fat. Yeah. I forgot.
Anyway, again, of course, as you see, just with a physical illness, you have all this lack of understanding. I think all of us who have depression know that it is treated differently than a physical illness. When it comes to a mental illness, let's face it, everything is different, pretty much, from a physical illness as far as perception. In reality, there are a lot of similarities. You get diagnosed, you get treatment. Granted, it's complicated, more complicated than, again, for instance, diabetes or heart disease or something. It's a lot more complicated because our brains are much more complicated than our endocrine system or our cardiovascular system. So most of us are used to getting these kinds of responses because people are equating depression, clinical depression, with things like being sad, being down, being in a rut, stuff like that. So let's look at these responses and look at what might be behind them, because when two people could say have the same response, verbal response to you, but they could be coming from different places. So the most benign is when someone says, oh my God, are you sure? Or something along those lines, because they're processing. And this is the way they process things. And all of us do this to some extent. When we hear about something bad, we might say something like, are you sure? Always give someone the benefit of the doubt. See what they say next, because it might just be that whole processing thing where they're just trying to get used to the idea, especially if they had absolutely no idea. So just always operate like from the beginning, your first response be, maybe they're trying to just process it. There's also the place where someone might just be in denial. Like, let's say this is your parent or someone else who is in a position where they're very concerned, your well-being is of great concern to them. And so this is coming from a place of fear, because anything being wrong with you petrifies them. And so this is just, a lot of parents will have this response if a child, for instance, says, I think I have depression, because they're scared. I'm talking about normal, well-adjusted parents. Could react this way because they're frightened. And I can tell you, as a parent, there is nothing more frightening than something potentially being wrong or being wrong with your child. Yeah. It's just like a visceral thing. So if you're, if you say this to a parent or a guardian, someone who's been a parent to you, and their reaction is denial, give them a little time to work through their first response, which is fear. Probably. As I said, this is for like well-adjusted people who are saying this to you. And that's another thing to remember. Remember that, your depression may come from a place of being damaged emotionally in your childhood or growing up or something. Well, what you need to bear in mind is that other people may also have that damage, and it may color what they say. So, maybe they grew up with someone who was depressed or had a substance abuse problem or something, and it's really hard for them to deal with any kind of mental health issues. That doesn't mean that they will not be able ultimately to accept it after they've worked through it, but it could mean that they don't, because they just it just triggers something in them. These are responses that come out of something that is controlling that person, their fear, their background, whatever. And so you want to give them a certain amount of slack. I think kind of like the last category is people who are just basically either fundamentally
bad people,
flawed to the point where they really can't have a healthy relationship with anyone. They have a kind of personality disorder, they're manipulative, they're narcissistic, and your depression would actually kind of get in their way of getting attention. The thing is, these are people who are going to, who possibly will never acknowledge that you have been, diagnosed. They may say something like, "Oh, who told you that? That was, that's ridiculous," or something along those lines. If you say that you've been diagnosed, well, I doubt that's really the case. They won't say something constructive like, "Well, is there any chance that maybe you should get a second opinion?" They'll just brush it off, or they will try to actively, basically gaslight you. So
those people are always fun.
In some ways, the people that we were talking about before, or the responses we were talking about before, to a great extent, were people who were unintentionally gaslighting you. So unintentionally trying to they're rejecting that idea, and they're not intentionally trying to gaslight you and basically change your reality, because that's what gaslighting is. It's someone trying to change the actual reality of what's going on, and in your mind, they know what's they know what's going on. They understand the reality of something, but they're trying to convince you that you're crazy, not in just a depressed way, that you're either overly dramatic or you're overly sensitive. Sometimes some things they'll say is you're overly sensitive, you're overly dramatic. Especially if you call them on something, they'll be like, you're just being overly sensitive. I hate
those people.
Or
so much.
What are some other things? Oh God, I hate those. I had a friend who did that. You're really just
they did that.
You're just taking this out of, you're just blowing this out of proportion. So they'll try to make you feel that, you don't have a right to feel that way or have that, have depression. And it's not like you want depression. Okay. I mean, this is not like you're like, wow, that sounds like so much fun.
Sounds so cool.
Yeah. Which makes it even worse because you never asked for this. Okay. So for someone to be denying your pain, your struggle, especially if you've just come to this realization, and it might actually have made you feel relieved because you knew something was wrong. You didn't know what it was. So if someone is, is this manipulative and the type of person who is gaslighting, what has to happen is basically you have to call them on it and you have to set boundaries. And will you be successful in making them realize what they're doing? Chances are you will not.
No.
But what it does is it makes you feel better. So, especially if it's someone you see a lot, you're going to hear this all the time. You may even try to avoid talking to them about your depression, but especially if, they're one of these types of people, they'll say, "Oh, well, let's just say your name is Lisa." Well, of course, Lisa thinks that she suffers from clinical depression, or something mean like that. I mean, that's, so when it's these types of toxic people, then you probably know, if you know someone like this, that one of their favorite things is to belittle you and, make you feel like crap. The reason we decided to do this video is because I ran into an article this morning on gaslighting and what you say to someone who gaslight you. And the first thing I thought about when I was looking at that is like, wow, that's exactly the type of thing you need to say to someone who's telling you can't, you're wrong, you don't have depression, you must be wrong, your doctor must be wrong. Like, and they're not just the people who are like inadvertently gaslighting you. So one thing, for instance, that you can say to them is, one thing you can just say is, F you. Another thing you could say is, wow, I didn't realize you got your medical license. But if you don't want to be snarky, because obviously this is going to not, especially with that kind of person, it's not going to make things, just calm down.
That's usually
not that you have to be the one to calm things down, but let's just say you want to get out of the conversation. First of all, the first thing is to recognize that this person is gaslighting you, and they're doing it for their purposes. They're not just doing it unconsciously. But one thing you can say is, my feeling, and this is, I have to credit this article on Lifehacker, what to say when someone is gaslighting you. So one thing that they put is, I think would be really helpful. My feelings and reality are valid. I don't appreciate you telling me that I'm being too sensitive. There's probably no point in arguing with them about whether you have depression or not. What you just want to attack is what they're saying. Listen, my feelings and my experience are valid. Okay, I don't appreciate you telling me how I feel or what I'm going through. And then if they keep on, you just say, there's no point in continuing on with this conversation. And anytime they might try to bring it up again, unless you have changed your mind about, what's happening with me, about the fact that I have clinical depression, I don't see any point in discussing this. Please don't bring it up again.
Yeah.
Yeah.
With these people, you really got to remember, they don't care what you think most of the time. And so you just got to be like, hey, I disagree with you. You're wrong.
Honestly, if you know someone like this, if you have a choice,
don't associate with them.
Cut them off. If this is someone in your family or some other situation where you don't have where you don't have a choice, especially let's say, you're young and you're still living at home and this is someone in your family. Just set the boundaries and
make it clear, hey, I disagree with you, and since you are probably not going to change your mind, let's just not speak about this.
But what you have to learn to do is stand up for yourself, but at the same time, don't waste your breath with someone that has very fixed ideas. Unless if they, if it has an effect on you, like if this is your parents, then again, the thing is to say, I'd rather a real doctor decide whether I have a
mental
illness. But so that's a situation where you're obviously going to have to push a little more. But basically, don't waste your breath on people like the people like the gaslighters. There's just no point, because they want to interact with you, they want to engage with you, and so what you want to actually do is just cut that off.
Well, if you enjoyed this video or found it helpful, you can give it a like. If you didn't, give it a dislike. If you'd like to say anything at all, you can leave it in the form of a comment. And if you'd like to see any more, go ahead and subscribe. But in any case, we hope that you have a nice day.
Take care.